for and a representative from KDHE in regards to COVID-19 mitigation strategies. So we are wanting to make sure to keep our content and our questions related to COVID-19 mitigation, but we absolutely would love to amplify anything that you all have that you would like to ask the source. Let's do it together. So we're thrilled to have a representative join us on our February 3rd session, which will be our 4th COVID series session. And our 3rd session is going to be the 27th next week, and you can sign up through our provider email, the Child Care Aware of Kansas, and we will also be sending out emails to this group here that is attending today. So that was a little bit of housekeeping, but I would love to actually introduce Jessica Soto Boteo. She is our Strategic Partnerships Manager, and she is going to go ahead and do some translation for us. So Jessica, if you wouldn't mind, that would be fabulous.
Hi, thank you, Sarah. Good afternoon, everyone. Hola, muy buenas tardes a todas. Como les había comunicado anteriormente, cualquier pregunta, comentario que gusten compartir, lo pueden hacer por medio del chat. Aquí estaré para traducir lo que ustedes gusten, o de las otras formas que habíamos comentado anteriormente el miércoles. Me pueden mandar un mensaje al teléfono igualmente, como se les haga más fácil, o si gustan participar, lo pueden hacer también llamando mi nombre. Gracias. Thank you.
Thank you, Jessica. All right, well, I would love for us to go ahead and kick off our very first session today and our conversation around COVID mitigation strategies. And we are thrilled to be able to have our nurse consultant, Erica McGinley, host our session today and walk you all through some strategies. And we are really focusing on modifying the day-to-day to incorporate some best practices so that you all can stay safe and keep the kiddos in your care safe and healthy as well. We do have a lot of really great content. So if you have questions that pop up, please go ahead, type them in the chat as you're able. And then we will, at the end, as time allows, we will absolutely get to verbal questions as well. Please try to make them as general as possible, just so that way we can make sure that we are honoring confidentiality when we're talking about kiddos in care and all of that good stuff. But without further ado, I would love to introduce Erica McGinley. She is a registered nurse with a master's degree in public health from Kansas State University. She worked as a public health nurse for a few years before transitioning to a position as the nurse consultant for a child and youth services program on a military installation. She worked with children ages 6 weeks to 18 years. Her primary roles in her previous position included teaching care providers on topics like medication administration, communicable diseases, bloodborne pathogen prevention, and diabetes. She is a Heart Saver instructor with the American Heart Association, and she offices from her home in Manhattan, Kansas. So, Erica, I would love to turn it over to you.
Well, thank you so much. And thank you so much to all you providers who have taken the time out of your day to join us this afternoon. I do have Miss Rachel helping me out with the slide deck transition today. I am, for all intents and purposes, not a technologically savvy person. I get by, but she is assisting me with that today. This COVID series is really all about you guys as providers. And so in session 1, our intent there was to come together and to gather feedback from you all. What things are going well, and what practices currently do you want to strengthen or focus on? Because as we all know, COVID has changed our lives. And as Sarah mentioned, we're going to discuss, really highlight some main practices within the childcare setting that need to be modified due to COVID. I want to preface this by telling you all that we did research best practice and most current information to bring you relevant material that is timely. That being said, we all know that CDC guidance changes on a weekly and sometimes even daily basis right now, and that can make it challenging to navigate. But we are here for you to support you. And this presentation was created as really a general overview. So some of the things that I reviewed today may not work for your program or your specific setting or your, your staffing situation. What I would encourage you to do is, if you have something that is unique or individual to your program that you really want to troubleshoot, at the end of this presentation, we're going to have the Child Care Health Consultant Network information available for you. We would absolutely love it if you would connect to a health consultant who can then pull in either myself or the other nurse consultant to work on those things individually with you, coming at that with a team effort, but we can tailor that more to the needs of your specific program. As Sarah mentioned, as questions come up during the presentation, I certainly don't want you to forget what it is you're wanting to ask. So please throw that up in the chat, and then we're going to hold questions to the end of the presentation. I know a little bit about a lot of things. So if there is something I don't know, I will be forthcoming with you and I will be glad to research that. So if something comes up in today's presentation that I cannot answer for you on the spot, we will send a follow-up email with answers to those questions to everyone, who has joined us today. We are going to go over, like I said, some highlighted topics, main practices that have had to be modified for daycare setting, including your pickup and drop-off procedure, looking at nap time and meal time, how we can potentially modify those activities in the childcare setting. We're also going to talk about daily health screenings, and I believe oral health was the other topic that had come up quite a bit, with our health consultants and in session 1 that you guys were kind of curious about. So next slide, please. Modified pickup and drop-off procedures. Again, let me just start by saying this is not a one-size-fits-all presentation, but I am here to bring you the most up-to-date and current information about how you can potentially modify this procedure in your programs. If possible, modify your pickup and drop-off procedure so that it can be located outside your facility. Okay, we know that fresh air, where there is good circulation and air ventilation, really helps to mitigate COVID. We also want to encourage a consistent friend or family member to drop off or pick up these kiddos. So we do better when we know better. And one thing that I've learned with COVID is we are not all receiving the same type or quality of information at the same time. So your parents may not have even thought of this. To them, it's like, well, today Sally could do it and tomorrow Gary can help out. But they're not necessarily thinking, okay, well, during this time, it would be really helpful if I limit the amount of foot traffic in the facility doors. So that can be a conversation that you visit with your patrons in your specific facility. Anytime we talk about contagious illness, you've got a person standing in front of you, and that individual essentially has a web that branches out from them, which are touch points throughout their day of individuals that they've come into contact with. So if we're all walking around with our individual webs of people and potentially pathogens that we've encountered, we are not coming to you as one person, we're coming to you as like a pool of contacts essentially. So as you think about adding in those additional folks for different drop-off and pickup procedures, essentially they're bringing all those webs with them. So something to think about to visit with your patrons about pickup and drop-off. Hand sanitizer near your pins and sign-in sheets. There are some numbers that have become kind of seared into our brains with COVID. And the 60% alcohol contact is one of them. This is something that has been consistent since the beginning of the pandemic. If you're going to use a hand sanitizer, you do want to look at the ingredients to ensure it contains at least 60% alcohol. Now, one of the suggestions for drop-off and pickup, if you're able to accommodate it, is to use a system that swipes in and swipes out children, like if the parents have a barcode, to eliminate any hands touching objects, okay? That's not gonna work for everybody. It may not even be a policy that you can have because you've got to have the physical documentation. If that is the case, just place some hand sanitizer near your pin and sign-in sheets with some signage that just indicates, please sanitize hands. Disposable masks being available at your entrance. This says to patrons, with some signage, masking is required when you enter the facility. It also makes the resource available to them. So if they forgot a mask, we've got one right here for you. And it's our facility policy that you mask when coming into the building. You also want to limit staff who welcome children at drop-off. Again, this goes back to what we talked about with the consistent friend or family member doing the drop-off and pickup. If you have designated a runner in your facility to greet the kids at the door and take them back to the classroom, you want to limit that, to maybe an AM and a PM runner instead of having, 10 different runners, because again, we keep that image in the back of our minds of that web kind of branching out from each person, because we've had contact with others who potentially could be infected. So we want to keep that staff to a minimum who do that particular job. And then again, this is education for your families. And we sometimes take for granted that people are just going to do the right thing intuitively. Sometimes they need a reminder. So encourage your families to watch for signs of illness and keep children home when they are sick. This is something that even pre-pandemic, I heard about a lot in facilities was from care providers is, yeah, the parents asked if they could come give Tylenol at noon and they won't tell us why. So situations like that do come up where parents are desperate for care and maybe they feel like they absolutely cannot, miss work. But that's why it's important to make sure that your facility illness and exclusion policy is current and that it's been provided to parents for them to review and acknowledge. If drop-off and pickup can't be outside, the suggestion for that then would be to provide hand sanitizer and hand washing stations at the facility entrance, and then to ask guests to wear well-fitting masks. Anytime someone's going to mask up, we do want that to cover both the nose and the mouth. Hand sanitizer, of course, must be kept out of reach of children at all times. And another option you could do to modify your pickup and drop off is to modify those pickup and drop off times. Not a one size fits all. I'm not telling you everybody can accommodate this, but if within your program, there's a preschool classroom, for example, they spend all day together. You could give that particular classroom a window in the morning. Your drop-off time is from this time to this time. So that group or that cohort of individuals is arriving to program at the same time, spending the day together, and then leaving together rather than intermingling several different groups or cohorts. Next slide, please. So I think the saying is, if those who cannot do teach. Well, I'm not having it. I'm not. If I tell you to do something, gosh darn it, I'm going to figure out that I can do it my own self first, because I just don't like to give examples or pie in the sky scenarios to individuals that don't apply to the real world. So as we are researching this topic and we're putting this slide deck together, I'm going, okay, if I am a family childcare provider, what do I have access to inside my home right now that I could use to make a sign in, sign out station outside the door? And this is what I came up with. So you're seeing a picture of my front door, and the supplies that I gathered included a table, the disposable masks, a clean container, a cup with pins, a clipboard with sign-in sheets, and then hand sanitizer. And I did check this label, and this hand sanitizer does contain at least 60% alcohol. And I had it on hand. So again, ideally with this situation, you would have signage posted as well that says, please sanitize hands before signing children in and out. And then masks are required to enter the building as well. Next slide, please. Daily health screenings. This is something that Caring for Our Children, has had in place as a standard prior to the pandemic. Options, ways that this could be performed would be that you're asking the family to do this step at home before they bring the child to care. So they have gone ahead at home before leaving and taken that child's temperature, verified that they don't have any symptoms. So when they come to your doors, they say, here is Johnny. And you ask, okay, what was Johnny's temperature this morning? And they tell you Johnny's temperature was 98.5 degrees, and he doesn't have any symptoms of illness. That's one option. Another option would be having a staff designated to perform this daily health check. Using a no contact thermometer and wearing disposable gloves. If that designated individual is not coming into contact with each child physically, they can wear that same pair of gloves, which is going to save you on resources for this process. They would be doing a visual check of that child for any symptoms. That is a quick glance over, okay? Johnny comes to program today. You can see it. He's got glassy eyes. His cheeks are really pink and flushed, and he is sluggish. That is an opportunity to open up the conversation while the parent is still there and say, Johnny looks different than yesterday. He looks like he maybe isn't feeling well. Can you tell me about how he's been doing this morning? Did he eat breakfast? Have you noticed any differences? Pose those open-ended questions that, prompts parents to be honest with you about the child's condition that day. We do want this health check to be brief. Of course, we are working with a limited amount of time. When dealing with COVID, we'll talk about that definition of what a close contact is here in a little bit, but you guys are all probably familiar with the 15-minute point being pretty critical. So we do want to minimize that amount of interaction time. And if you have your staff performing that daily health check, another option would be to keep a daily log where you have a roster of your children and the provider marks, yes, I did a daily child check, or no, I didn't. And then they can record that temperature that they got when they used the thermometer on them that morning. And next slide, please. Here's a visual tool you can use in your program. So we've linked it into the presentation. You can pull it up and print it. It's from the American Academy of Pediatrics. It is a visual tool for you all to post for parents. And what it states is, did your child or anyone in your household have any of these symptoms in the last 24 hours? Brings up a great question, because maybe Natalie feels great that day. But she's got a sister at home who's got a fever, a terrible cough, feels horrible. Sounds like maybe sister needs to be tested for COVID. If sister is undergoing COVID testing, we probably don't want to have Natalie in program that day, potentially, exposing others because she's a first-degree contact. So it just really gives a visual cue to parents. Again, hey, we're looking for these symptoms. If anybody in your household is experiencing this within the last 24 hours, please contact the doctor and keep them out of care for the day. All right, and next slide. Children should not enter the program if they've had close contact with someone who's COVID-19 positive. They are waiting for results from a COVID-19 test, or they've recently been diagnosed with COVID-19 and have not been cleared to discontinue isolation. Close contact, I said I would define that for you. And so we're probably familiar with that definition that comes from the CDC. But it's anytime you're within 6 feet of a positive individual for 15 minutes or more over a 24-hour period of time. So that means if you stand next to Sarah and you talk to her for 10 minutes that day, she's COVID positive, you find out. And then maybe that afternoon you went off, did separate things, and you came back together for another 5-minute period of time. You meet that definition as a close contact, because within a 24-hour period of time, you've been within 6 feet of that COVID positive individual for 15 minutes or more. Next slide. We talk so much right now about reasons children cannot come into program, right? And I think parents are equally as frustrated, because sometimes they feel like, well, I can just never bring my kid to care unless they're in absolutely mint, tip-top, perfect condition. So I really appreciate that Caring for Our Children has teased out some of these symptoms or conditions that do not require exclusion. And what I encourage you to do is to go to this link and to gain some knowledge for yourself, kind of reviewing and exploring this standard where Caring for Our Children addresses this. But common cold, typically common cold does not involve a fever. Okay, if that child is well enough to come into care and participate and not jeopardize the health, safety, and well-being of others, they can attend program. I really like this next bullet point, addressing that a cough is not associated with a cough that's not associated with fever, difficulty breathing, wheezing, or blueness of skin. Okay, cough is one of those general COVID symptoms. However, cold, dry air could produce a cough in a child. Maybe they're not communicable. Anytime that you are in question of this and just not sure, make sure that your illness and exclusion policy includes, hey, I do reserve the right to have you bring in that doctor or provider's note that clears the child to return to care. So you can get that that go ahead, from the medical professional that says this child doesn't have a contagious illness and it is safe for them to return to program if you're in question. Same thing with eye drainage. It says yellow or white eye drainage not associated with pink or red whites of the eyes. Do encourage you to go on to Caring for Our Children and read more about this because they have some updated information about pink eye as well. But sometimes kiddos have a blocked tear duct, or maybe they have some allergies that are creating a little bit of eye drainage. Thrush. Kiddos can come into program with thrush. They're not communicable. This is essentially a yeast infection of the mouth. They may be under treatment. But as long as they can eat, drink, and participate, they should be allowed to come into program. Middle ear infection. This one, again, not communicable to other children. Sometimes they'll have an illness that is associated with, that accompanies that ear infection that is communicable. And maybe they need to be excluded for that reason, but just simply for having an ear infection, that's not the case. So I do encourage you all to go in and read that additional information set out by Caring for Our Children. Next slide, please. This is the daily staff health check. So staff experiencing these symptoms should not enter the program. If they've got a fever, chills, sweating, new cough, fatigue, new loss of taste or smell is a hallmark symptom, sore throat, headache, runny or stuffy nose, muscle pain, body aches, nausea, vomiting, or diarrhea. We have some very dedicated workers in this field, and so some of them will try to come into program when they're not well enough to be there, and that's a hard thing to navigate. But gently remind them of the safety and wellness of all the staff and the patrons that come in through the doors. Staff also should not enter the program if they're waiting for results of a COVID test or have had close contact with someone who is COVID positive. And next slide. We're moving into talking about cleaning, sanitizing, and disinfecting. Sometimes these terms get interchanged, and they are not all the same thing. They have separate definitions, so I wanted to review this with you quickly. A cleaning solution is made up of soap and water. So it could be dish soap mixed with water, it could be a powder detergent mixed with water, but this is a solution that's used to physically remove dirt or debris from surfaces. You got a layer of slime on there, use your soap and water first, because your sanitizer or your disinfectant isn't going to be able to penetrate the surface if it's covered in yuck. So we use it before we sanitize or disinfect. Sanitizing solution is a mild solution of bleach and water that reduces the amount of germs on a surface. I have bleach specified here, but there are some other sanitizing solutions out there that are not composed of just bleach and water. This is used exclusively on food contact surfaces and objects that children put in their mouth. Disinfecting solution is a stronger solution of bleach and water. It's got a stronger concentration of bleach than a sanitizing solution has. This is used to destroy most germs on surfaces, and it's applied to all non-porous surfaces. So think toilets, sinks, doorknobs, trash cans. That's where we'd be using those disinfectants. We use a disinfectant solution on our diaper changing table. Next slide, please. If you are in need of a cleaning frequency chart, you're like, I need somebody to just organize this for me and tell me when to do what and what types of solution to use, NACI has done it for you. And we have linked it here. So if you are not already familiar with this or have access to it, you can certainly click on the link and then access that full chart for yourself. Next slide, please. Key times to sanitize toys. Immediately after a child puts a toy in their mouth, coughs or sneezes on a toy, we want to use the yucky bucket method. So that toy, when the child drops it, should be immediately removed from the environment and placed in a bucket that's out of reach of children. This is to keep them from exchanging those germs. If you're going to have cloth toys, they've got to be washed or sanitized, in between each child. So cloth toys should be used by one child and cleaned or just not used at all. We also should be sanitizing toys before and after they're shared with a group of infant or toddlers. Toys that cannot be cleaned and sanitized shouldn't be used. All right, next slide. And if you're asking yourself, what products do I even use for sanitizing and disinfecting? Caring for our children goes over that nicely in Appendix J. So we have linked that here in the presentation for you. Next slide, please. Managing bleach solutions, key tips with that. Don't ever mix your bleach if you are going to choose to make your own sanitizing and disinfecting solutions with any other household cleaning product. This could create a harmful gas potentially, so please don't do it. Use a chlorine test strip. This is best practice to verify that you have the proper concentration of bleach. If you're trying to make a sanitizing solution or you're trying to make a disinfectant solution, you want to make sure that you've actually got it at the proper concentration. It's also advised that you dispose of bleach solutions at the end of each day. The main component in a bleach solution is sodium hypochlorite. That decomposes whether you put it on stuff to disinfect and sanitize or not. So the way to make sure that it's strong enough to actually do what you need it to do is to throw it out and prepare a fresh solution each day. Storing it out of direct sunlight is for the same reason, because it will decompose that bleach more rapidly. You also need to store it in a location that's inaccessible to children for safety reasons. And then once you've made a solution, label that bottle as either a bleach sanitizer or bleach disinfectant, including the concentration on it and the preparation date. That's best practice guidance. Next slide, please. So how do you disinfect after you've had a positive COVID-19 case in your facility? Well, before you clean and disinfect, you want to close off those areas that were accessed by the person who's sick, and then wait as long as possible for several hours before you go in to clean and disinfect. So what is COVID-19? It is an airborne virus. So if those particles are still floating around in the air, we want to give them time to settle. Okay, we don't want to walk right in and just be breathing in that pathogen. So give it some time, close off that area. Once you've done that and it's time to clean and disinfect, you want to open the doors and windows if possible and use fans to increase air circulation. Wear a mask and gloves. Focus on those immediate areas that were occupied by that sick person. You can wash all dirty linens, and it is okay to mix those dirty linens with other things that you need to wash, okay? Always follow the directions on your product label. If you're wanting to know which disinfectants are effective against COVID-19, EPA has created what's called a list in, and the link is in our presentation. There's even a tutorial that shows you how to use list in. So that can be a very helpful tool. Next slide, please. This one-page infographic gives you a really quick overview of what you should do to properly clean and disinfect during COVID-19. So this comes from the EPA, the Environmental Protection Agency, and we have that linked in the presentation as well. So if you want to print it and use it as a resource, it is available for you. Next slide, please. Alrighty, we're moving on talking about modified dining practices in childcare settings. So this surprised me when I read this in Caring for Our Children. They do have it with a caveat, but they say programs may resume family style meals if, but with that caveat to consult applicable state licensure and public health requirements. But children 2 years and older wear a face covering until they're ready to eat. You should have the table already set with serving dishes, water pitchers, and utensils. And then we want to seat children further apart. This is pretty vague guidance, but they're just encouraging that there be better spacing. Hands are washed prior to and after eating, and that if possible, children are eating outdoors or in a well-ventilated space. The food surfaces are cleaned and sanitized before and after meals. And again, just like hand washing, this is something we should have already been practicing. So not really new news there. Next slide, please. And I think the value that we all have found with family style dining is that it promotes the social and emotional development of children. It's also a good opportunity to work on their fine and gross motor skills, and a time where the caregivers can be positive role models. So I think right now we're constantly trying to balance how do we still give kids those social and emotional experiences that they need? How do we meet that while we're also trying to mitigate COVID? So I would guess that's where this re-implementation of the family style dining has kind of come back into the picture. But during that time, you know, you guys have those positive experiences where you hold conversations with children at the table. We still want to make sure that we are watching them to make sure they're not eating each other's food or sharing food. This is for health and safety, food allergy purposes, and then practicing that physical distance at mealtime. Again, if it's possible in your program to stagger your meal times, to space your tables differently, or to create smaller groups if your space is limited. Those would be options to kind of help during COVID mitigation. Next slide, please. These are my kiddos. They're making a guest appearance here, so I'm pretty proud of Mr. Rex and Mr. Arlo. They are demonstrating the head to toe nap position. So I wanted y'all to have a visual tool just to see if Arlo starts coughing, he's coughing into Rex's feet. He's not coughing into Rex's face. So this is the benefit of the head to toe napping position. Next slide, please. We do want to allow as much room as possible in between cots and cribs. At least 6 feet is recommended. Now this is tricky, okay? Not everybody has the luxury of having all this space to put kids 6 feet apart, okay? So just bear with me here because I got some ideas. Placing cots, cribs, and sleep mats in the head to toe position, of course, that is helpful. Continue to keep each child's bedding separate, so stored in individual cubbies, bins, etc. If bedding touches a child's skin, it should be laundered weekly. Or if it's going to be used by another child, it needs to be washed before another child uses that bedding. Here's the creative part, which y'all are probably already doing, but we can create barriers by placing those nap mats or cots on either side of furniture or shelves, okay? So if we can't meet the 6 feet criteria, we can at least be creative with spacing. Next slide, please. Getting into oral health here. Staff and children have to wash their hands with soap and water for at least 20 seconds before and after brushing teeth or assisting with teeth brushing. If you're going to do this practice at a classroom table, you want to seat children as far apart as possible with staff supervision at all times. If a table is not available to you, you can use a sink with staff supervision. We do want to encourage children to avoid placing those toothbrushes directly on the classroom table. Next slide, please. The recommendation is that program staff who brush children's teeth or assist them be vaccinated against COVID-19. They should be wearing a well-fitting mask that covers both mouth and nose during teeth brushing and in your programs. The sink should be cleaned and disinfected after brushing teeth. Table should be cleaned and sanitized. And then again, just re-emphasizing that staff should wash their hands for 20 seconds before and after assisting children with teeth brushing. And next slide, please. We do want to make sure that toothbrushes are used by only one child, as was the practice pre-pandemic, and those should be individually labeled and age appropriate. Toothpaste can be supplied on an individual paper towel or in a disposable cup. And then when we store those toothbrushes, we want them on a clean surface with the bristle end up, so those bristles are allowed to air dry. They're not contacting each other, and they're also not dripping onto each other. These should be replaced on average every 3 to 4 months or sooner if the bristles become frayed or if that toothbrush becomes contaminated. So if a child in your program leaves sick, the toothbrush needs to be replaced. If that toothbrush touches another child's toothbrush, we need to replace it. If the wrong child accidentally uses the wrong toothbrush, we do need to go ahead and replace that. And so that kind of wraps up here. We've got our references slide next of all of the sources that I had reviewed and compiled to bring together, hopefully some helpful information for you all for your programs. And I think at this time, we'll be free to take questions.
Fantastic. Thank you, Erica. I did also want to just let the group know that I did go ahead and put some of those live links in the chat as well. So feel free to navigate over to the chat if that is convenient for you. And you can click on any of those live links, but we are now here absolutely to answer questions and hear from you all. Thank you, Erica.
And I think, were there questions that came in on the chat during the conversation?
You know, not quite. Everyone, I think, was very captivated by your teaching. You know, I have to say, did a really wonderful job of giving us some visuals and opportunities to explore those regular routines and care. But if anybody does have any burning questions or immediate needs, you can share them. And the thing about it is too, if we can't answer it today, we can always address it for our third and fourth part as well.
And while we have free space to talk, I did want to tell you all, thank you so much. This pandemic has been hard on everybody, and you all are essential workers. You have kept us in our jobs, and you've kept our kids happy and healthy. And I have nothing but gratitude to express to all the childcare providers out there who do that important and right now really difficult work trying to navigate the pandemic. So thank you.
We got some feedback in the chat, and I have to agree, this was one of my favorite pieces from today, was the concept of the webs, the teaching that you shared, Erica, about the contact and how we all walk around with that web. That was really an excellent way to visualize that.
That's my public health epidemiology talk coming out.
I like it. Came in handy.
And I apologize for the timing. I was taking my sweet time at the beginning. So at the end, I'm like, okay, we're going to keep it open for questions. So I'm going to just chug along. So if it felt like I slowed down and then sped up, I did. But I just wanted to make sure that if there's anything you wanted to ask of us here while we're all gathered today, that you had time to do it. And if you think of something after we leave here, like I said, the slide that's up right now, we would love it if you connected with us individually, because that's what CCHC, or the Child Care Health Consultant Network, has been stood up to do, is to support you, to connect with you, to work with even what you may think is the most minor thing that you want to resolve or improve or strengthen in your program. We're here for you.
Absolutely. And to that note, I did go ahead and put in the chat as well our additional sessions that we have scheduled. We have part 3 coming up January 27th at 6:30 p.m. and then part 4, February 3rd at 6:30 p.m. Looks like we have a question regarding quarantine. So the newer 5 to 5 quarantine, Erica. I'm not sure if that is something, I know we talked a little bit about some quarantine things in preparation for this today, but someone did ask a question regarding that in the chat.
Okay, so is this a question regarding shortening the quarantine time? Is that what I'm understanding?
I believe so, yes.
Okay. So I did pull for next week's series the KDHE current guidance on isolation and quarantine. And as of January 11th, 2022, their recommendation in a daycare setting is to still quarantine for 10 days. Now, if you are in a critical staffing shortage and you're needing to use a staff member who is in quarantine, so let me back up and define this. Isolation means I tested positive for COVID. I have to isolate myself from others. Quarantine means I was in direct contact with a positive COVID-19 case. I haven't been identified as a positive, but it's more likely that I'm become positive because I had that direct contact. So this is for quarantine only. Where they've talked about if you have a critical staffing shortage, that you can consult with your local health department and run your scenario by them and say, hey, I have a staff member that I really need to come back to work. They're on day whatever of quarantine. This was the exposure date. This was the situation. The KDHE guidance currently says for the 10-day quarantine to be implemented, or if it's a critical shortage, that you reach out to your local health department and work that in consultation with them. Does that answer that question? Okay.
Erica, I have a question from a provider. She wants to know where can the strips be, where can they buy the strips to check the amount of bleach?
Ooh, there's all kinds of resources for that. So why don't I send some links out following in our follow-up email?
Thank you.
Absolutely.
All right. Well, I know everyone's time is incredibly valuable. And so we will stick around as a team a little bit longer. If anyone would like to hang around and ask questions with a smaller group present, we will be here for you. And oh, it does look like there was another question that popped in regarding a parent. If a parent has COVID, does the child's 10-day, when does the child's 10-day quarantine start?
Yeah, so this gets tricky, right? Because the parent's positive, but the child's not, and they're all living in one house. Okay, so in this situation, I really encourage them to consult with their health department and follow the guidance that's been given them. What I will tell you is this: if you have a positive COVID case in your house, okay, it is very unlikely that the child is separated from you for 10 days. Very unlikely to happen, especially if that child is young. So think of it like this. that positive case is exposing that child every single day until their isolation period is complete. So if that parent is told you need to isolate for 10 days for your positive COVID case, that child's quarantine period cannot begin until their last date of exposure to the positive case. So that's the parent's day 10 of isolation. That next day starts the quarantine period for the child. Does that make sense? And it's tough, guys, because parents will be like, are you kidding me? Like, I just spent 10 days at home sick and now my child has to stay home for additional time. But that's the best way to explain it is, listen, if you had contact with Jackie on Thursday and then you don't see Jackie, you start quarantining. But if you saw Jackie every day that she was sick with COVID, you've repeatedly been exposed to a positive case. The only situation where, and this is very difficult to implement, the child could co-quarantine is if that parent truly went to a part of their home where the rest of the family didn't have access and they isolated, and then the child and another caregiver were like in the basement and they used a separate bathroom and they ate in a separate space, things like that. So I do encourage you, to work with your health department and to have the parents work with the health department as well, because, that's the bottom line. And I know it doesn't always make sense and it's not an answer that anybody wants to hear, but does that answer the question?
I believe so. They're following up with a little bit more information regarding the timeline and the 5 days. Does the child start the 10 after the parent's 5? But I believe you touched on that a little bit there and how we need to handle that.
Yep. So if their isolation period has been given to them by the health department, the child's quarantine period can't start until after that parent's isolation period has been completed.
Thank you. Absolutely. Yes. And this is very much something that we have targeted as part of our series for our next time to get together as well. Erica's been doing a lot of research on these specifics, and we can definitely share some of those resources in our follow-up email also to get you all by and through until we meet next. Okay, well, our next couple of sessions will revolve a lot around some of this discussion that we had, some of these definitions and clear-cut guidance as far as what do we do in the event of XYZ and how to navigate that mitigation and keep children and families and yourselves safe. So I would like to echo the thank you that Erica gave. Thank you all for your hard work every single day, keeping our communities afloat. We truly appreciate you. We are here for you. So reach out in any capacity that you're able, and we will get back to you and support you. Even if you just need an ear or someone to connect to right now, we are here for you. So thank you all so much. We are hopeful that you can join us next week, and please stay tuned for an email following up with those resources that Erica mentioned, and we'll stick around as a team if you'd like to engage in a little bit of a smaller group. Thank you so much. Have a wonderful afternoon. So Stephanie, I'm seeing in the chat you shared about the tests, and we actually as a team have shared and visited on some resources. There is one called Battelle that does share tests with providers, and we do have that information. So what I will do, Stephanie, is I will send you a private message through the chat with a link to that resource right now. So if you just stay put, I will get that sent on over to you. Well, Erica, it was wonderful to hear you teach today. Thank you very much. Thank you. Thank you.
Good job, ladies.
Thank you
Great
guys for
job.
helping with the slides, and that part would have probably thrown me over the top, Rachel. So I appreciate it.
Hats off